Hello guys, we are Nursing Ninja and we are today tell you about the APGAR score that you usually listens during your pediatrics posting or classes. So let's discuss about APGAR. So first of all, I introduce APGAR score to you. So first of all, APGAR score is a score that is used to measure usually for the newborn baby at the time of birth after 1 minute and after 5 minutes of birth. Then I describe you about the APGAR score. What does the APGAR means? APGAR is usually mnemonics used for A for appearance, that how the baby looks, and then next P for pulse. What is the pulse of the baby? G for grimace. Grimace means activity or the look how the baby is moving or not moving. A stands for activity and R stands for respiration. So guys, there is total overall scoring for the APGAR score is 0, 1, 2, and based on that APGAR score we will define about how the baby looks, and based on that total scoring our total scoring will come. So first, appearance, the baby having overall appearance bluish. Overall baby appearance looks blue. Suggest our cyanosis. That means we will give the baby blue. Cyanosis means 0 points. Cyanosis 0 points. Then we will further move on the baby having only extremities are bluish, and this term known as acrocyanosis. Only extremities are bluish in coloration, and we will indicate state it as acrocyanosis. Acrocyanosis, and we will mark it as score 1. Then we will further move on a pink baby. When the baby is normal and looking pink in color, that means the baby is pink in color. So baby means normal. So we will give the baby 2 points. Normal baby, pink body. So now we will move on the pulse of the baby. So we will check the pulse. If the pulse is absent, we will mark it 0 points. And then if it is less than 100 beat per minute, then we will indicate it as score 1. And if it is more than 100 beat per minute, then we will score it 2. Next, we will further move on grimace. Grimace means the baby how it responds. If the baby is not move at all, we will score it 0. Or when after providing stimulation, when stimulation provided, then only the baby responds, then we will mark it as 1. And if baby responds on even when stimulation or not even when stimulation, the baby respond, mark score 2. Respond quietly, good response, but in this only stimulation provided, then only minimal response, then we will term it as score 1. And if response is good, then we will score it as 2. Then we will further move on the activity. Then activity, if the baby is lying and showing no response, if the baby is like flaccid, then we will score it as 0. No movements. Lying like no movements, then we will score it as 0. If the baby is flexed baby, as well as arms and legs are proper flexed, then we will score it as 1. And if the baby is actively moving, then we will score it as 2. Next, we will further move on to the respiration. Respiration, if the baby is having no breathing, if baby is not breathing, no breathing at all, then we will mark it as 0. If the baby is irregular and slow breathing, then we will mark it as 1 score. Then further move on to strong cry. because strong cry indicates that their lungs are properly cleared and the baby is able to cry. strong cry or vigorous cry. Then we will mark it as score 2. Okay, then the total scoring of the indicate 10. Total scoring and when the score more than 7, no treatment or any special care required. Mild. 4 to 7, it's moderate and supervision is required. And less than 4 indicates severe, that means supervision and proper treatment is required. Proper treatment is required for the baby. That's it, guys. Thank you so much. And who don't subscribe, please subscribe. Please subscribe. Thank you.